And welcome to my Module 2 discussion on erectile dysfunction and overactive bladder. Let's first talk about the efficacy of herbal treatments for erectile dysfunction. These treatments have been around for a very long time, so I'm fascinated. There must be something that keeps them active in society as a treatment for erectile dysfunction. They can serve as a starting point for study, not just of the botanicals themselves, but the receptors and mechanisms of action that they employ. This may lead to more and better treatments for erectile dysfunction in the future. Of note, the article that we were directed to had no citations of the studies that they mentioned. If I had come across this on my own, I actually would have dismissed it as unreliable. So, what are some safety concerns and potential risks of natural remedies for erectile dysfunction? So, published studies that were looking at these supplements had controlled dosage and controlled quality of the product they were studying. In reality, these products commercially do not have to undergo clinical trials to establish their efficacy and safety as other drugs do. There are no federal standards for quality control or standardization of the product. Supplements and herbs that are marketed for erectile dysfunction may contain these ingredients in varying amounts and of varying potency. There have also been instances of undisclosed ingredients, including sildenafil, being present in these supplements that could have adverse outcomes for patients with certain health conditions and who are taking medications such as nitroglycerin. And this can really erode the trust of the consumer with these companies. So let's talk a little bit about the differences between these natural herbal supplements and conventional treatments. So the natural or herbal treatments take longer to achieve a result. They take weeks, where conventional treatments can take minutes or maybe an hour. That's believed to be tied to an incremental increase in testosterone as opposed to conventional medications that inhibit phosphodiesterase type 5, changing penile blood flow. The three supplements highlighted in the article are not even mentioned in the erectile dysfunction guidelines for treatment from the American Urology Association or by the National Institutes of Health. Let's switch gears a little bit and talk about incontinence. What happens in the bladder? So normally, the bladder detrusor is stimulated to contract through muscarinic receptor stimulation and is relaxes by having that stimulation blocked by atropine. Specifically, detrusor muscle contraction occurs when the parasympathetic nervous system releases acetylcholine, which binds to the M3 muscarinic receptor on the cell wall, activating them. Activation of the M3 receptor then produces the cascade that you see there, causing muscle contraction. When this happens involuntarily, episodes of urinary urgency and leakage can occur, leading to incontinence. So let's talk a little bit about a couple of treatments for overactive bladder. Oxybutynin is first-line treatment for overactive bladder. It's an anticholinergic medication. It relaxes the smooth muscle by blocking the acetylcholine from binding to muscarinic receptors, and it promotes the relaxation that way. Oxybutynin is M3 specific and so does not affect smooth muscle of the brain or skeletal muscles, which have M1 and M2 receptors. Oxybutynin can cause anticholinergic response in the CNS, as there are some M3 receptors there. Patients may experience hallucinations, confusion, somnolence, some agitation, especially in the first months of therapy. So it's to be used with caution with patients that already have cognitive decline. Oxybutynin decreases the ability to sweat in hot temperatures. This can contribute to fever or heat stroke, and patients should be very cautious when outdoors when it's hot. Second line treatment for overactive bladder is mirabegron. This is a beta-3 adrenergic agonist. It helps relax the smooth muscles by stimulating the beta-adrenergic receptor. Because beta-3 receptors are also found in the GI tract, mirabegron can cause GI side effects such as diarrhea or constipation, depending on how the smooth muscle responds to the extra stimulation of that receptor. Beta-3 receptors are also found in the heart, and mirabegron has led to hypertension in some patients and carries a risk of other arrhythmias, including AFib. Here are my references, including links to the figures that I used in my presentation. Thank you very much.